Don't study harder, study smarter. Don't know how? Let me tell you with this video. So, today we're going to study about the stages of grief, and we will learn that we will never forget in our life with some tips and tricks and an explanation. So, let's begin. Today's topic is stages of grief. First, we will begin with what are the 5 stages, and then we'll come to the trick. So, the 5 stages are denial, anger, bargaining, depression, acceptance. Trick, it's there only, which is DABDA. D stands for denial, A anger, B bargaining, then D is depression, A is acceptance. This is a very famous trick and you all must know about it. So let's begin with the explanation. First is denial. Denial is a situation in which the person denies or didn't accept the condition or the situation. Let's assume a case. The patient or a person name is Sham, and he is recently diagnosed with cancer. So first, when he will get to know about it, he will deny it and doesn't accept it. The thought which comes in his mind will be, this cannot happen to me. Then after few days, when will be anger. So then the next stage is anger, where he will get very aggressive. The thought which comes in his mind will be, why I am suffering, why this happens to me only, what have I done, or what I had done, and why only to me this is happening. So the person always remain furious and very angry to all and to himself and to everybody. Then the next stage is bargaining. In bargaining, the person now tries to bargain with God. He prays to God, means he thinks now, after realizing that I am having this problem, now he tries to find the solution. So he appeals to God that, dear God, if it does not happen, I will give away so and so to you. So he starts bargaining to avoid the situation. The next come is depression, because it is a serious condition. So Sham now goes into the stage of depression. Thought, I am too sad to do anything, means he is depressed to think that this disease cannot be cured and nothing can happen, so why I should do anything. Or he didn't want to do anything, he just want to lie on the bed or just withdraw himself from everything. Then the last stage comes is acceptance, when the Sham accept the disease and decide to go through it. So the thought comes in mind is, whatever happens, it happens for a better reason only. I know, I have faith in me and I accept it, and it will definitely cure, and I can do this. I'll go for exercise or anything and I'll accept, and everything happens for a better reason. So the trick to remember is DABDA. Easy. Now the next come is stages. These are the stages which occur in adults. The scenario is different in children. In children, there is no DABDA. There is mixture of all the stages. So, in this, first is disorganization, in which the children have lots of mood swings, depression, regression. Anybody know about regression? This word regression, it means when the person goes in former state, means he behaves like a baby. In for example, he will suck his thumb and means returning to a former stage or underdeveloped stage. Then there are mood swings, depression. This is disorganization. The baby cries, children cries a lot, they cringes and very aggressive. The next stage is transition. In transition, the children become hopelessness, chaotic, despair, means they are very sad and they don't want to do anything. They remain withdrawal and they just became messy and chaotic in nature. Then third is reorganization. First we have disorganization, then everything becomes reorganized, means he accepts the situation, he gets motivated and positivity in life. So these are the three stages in children: disorganization, transition and reorganization. So the next which comes is a this is a cycle by the which is called Kubler-Ross grief cycle. First we have denial, means we avoid confusion, elation, shock and fear. Then comes the anger, in which we get frustrated, irritation, anxiety. Then the bargaining, in which we feel helplessness and bargain with the god. Then comes the depression, in which struggling to find meaning, reaching out to others, telling one story is means he gets depressed, he don't want to do anything. Then finally the acceptance occur. So this about information and communication, then the emotional supports he needed, and finally the guidance and direction towards a acceptance stage. So these are the stages of grieving, which is given by very important and asked in NORCET exams also, that who gave the stages of grieving. So it's Kubler-Ross. So finally we come to an end. I hope that all of you enjoyed the video. So please like and subscribe my videos and comment if you want to know about any other videos or you want to get any information about any other concepts.